Welcome to the Autism in Black podcast, where we focus on all things autism and the Black parent experience. Our goal is to always educate, support, and empower parents to advocate for not only their children, but themselves. Hello, and welcome to the Autism in Black podcast. I'm Maria Davis Pierre, a licensed mental health counselor in the state of Florida and America's #1 autism advocate for Black parents. I am the founder and CEO of Autism in Black, Inc., where we aim to include the excluded. Today we have Dr. Cindy T. Graham, who is a licensed clinical psychologist and owner of Brighter Hope Wellness Center in Clarksville, Maryland. With specialties in treating children and adults diagnosed with autism spectrum disorder, intellectual and developmental disabilities, and severe behavior problems, Dr. Graham treats children, teens, and adults with anxiety, mood, inattention, hyperactivity, and impulse control issues. Dr. Graham has earned a bachelor's degree from Princeton University and both master's and doctoral degrees in clinical psychology from Louisiana State University. She then trained at the Johns Hopkins School of Medicine, Department of Pediatrics, with rotations at the Kennedy Krieger Institute. I'm really excited at having Dr. Cindy on the show to talk about the medical side of the diagnosis, as well as evaluations and what parents can expect. Enjoy today's episode. Hi, and welcome to another episode of the Autism in Black podcast. Today we have a very special guest, one of my colleagues who I've met in person, and I just love what she does dearly. We have Dr. Cindy today, and I'm so happy to have her here. How are you doing, Dr. Cindy?
I am well. Thank you so much for having me. I've been very much looking forward to being on, so I thank you so much for the invitation.
Thank you. So I have read your very impressive bio, and I want you to tell us more about who you are and what you do.
Yeah, thank you. Thank you for that. So as you've already mentioned, my name is Dr. Cindy T. Graham. I have a PhD in clinical psychology. I am a licensed clinical psychologist in the state of Maryland, where I am the founder and owner of Brighter Hope Wellness Center and also one of the practicing clinicians. Brighter Hope is located just west of Baltimore City in the kind of like suburb areas out there. And we specialize in autism spectrum disorder and intellectual and developmental disabilities. But then we also provide services to a range of diagnoses from ADHD to bipolar disorder, anxiety, and depression. And we really see kids across the full age range. And we also provide ABA services, most importantly, particularly for your audience. So I am also a wife and a mom to two very full of energy boys who I love dearly. We're all home together right now, as we all are during this pandemic. But and so all those things are really important facets of my life because, it's definitely balancing all of those things and kind of prioritizing at any given moment. But I really love all those things about myself. And obviously I'm an individual too, so I have my individual passions and things, but and autism really does happen to be one of them. I first started in the field, and I very much date myself, but in 1998. And so I just really fell in love with working with some toddlers, preschoolers at that age. And that was really my introduction to autism. And it's been full on ever since then.
Wow, that is amazing. So I'm going to get right into it because this is a topic that my audience has been asking for. And of course, I wanted to bring somebody who does the work, does the evaluations, on a daily basis. So I talk to parents all the time about the difference between an actual medical diagnosis and a school categorization. But can you tell us the difference between the two?
Yes, thank you. That's a good question. And it's a really important question because it's one that when it comes to the individual education plan, that is really quite significant because for kids who are now categorized in the higher level of support or kids who used to be diagnosed as having Asperger's syndrome, the difference between a medical diagnosis and a school categorization is quite significant. So a child or an individual can meet criteria for a diagnosis of autism spectrum disorder just based on, the testing that we go through, the different questionnaires that we give, the activities we ask you to do, the observations that we make, but then sometimes and lots of times it's for the quote unquote higher functioning, higher level, requiring less level of support, that if there is not an academic impact to the functioning, then lots of times that is where we especially start to see that struggle with getting services in the school setting, because the school's priority is academics. And so if a child is really thriving, they're at grade level, sometimes even ahead, but still has an autism diagnosis, that child might not qualify for actual additional supports through the school system. And so that's where bringing in things like an advocate becomes very important. Having the psychologist who diagnosed autism getting involved becomes significant, because what I tend to see is that the ways in which social and emotional social communication functioning impacts academics can be quite significant. And so those are the things that need to be communicated to help a child to get the proper supports that they need in a school setting.
Mm-hmm. And I know something that I see common with parents is that they think if they have one, they don't necessarily need the other diagnosis. So they think if they have the school categorization, which I let them know is not an actual diagnosis, they think that can then be help them outside of the school, like with insurance. And we have to let them know that, they need the medical diagnosis for that. Can you explain why that is the difference in that?
Sure, and I think you explained it pretty well. It comes down to insurance and coverage. So especially for ABA services, in particular, most insurance companies will run into a plan here and there which won't require an autism diagnosis, but most insurance companies will require a formal diagnosis from a licensed professional. So it can be an MD. So like if a psychiatrist is conducting testing, a developmental pediatrician, all the way to psychologists. And usually they're pretty specific that it has to come from a doctoral level clinician. So usually they're developmental pediatrician, psychiatrist, or psychologist, because it's paper. I hate to say it's paper compliance in case any insurance companies are listening. And I do work with insurance companies. We take insurance, but it often is a paper compliance issue, and that a lot of the process of access to services is very much tied up in regulations. And so, insurance companies are very motivated, and they would say it's to reduce the likelihood of fraud, which, I respect and I understand. And so they do have their rules and regulations to help minimize the likelihood of these services being taken advantage of. But then what it does end up happening is that then parents, especially if you did get that diagnosis through school and it wasn't given in accordance with insurance or by a doctoral level clinician, then parents are like, wait, I have to go through another set of testing for my child. And so that can be quite understandably frustrating. So it really is to make sure that you are able to capture the different facets. And so another way to think about it as well is that the school is an entity in and of itself. Like each state has a superintendent that's the head of like the state school systems. So school really is an entirely different entity from insurance companies, from mental health. And so that's really the way to see it. And unfortunately, there just isn't, those two arms don't speak well to each other right now. And so that's why, unfortunately, parents sometimes do have to get that additional diagnosis. That is often why I recommend that parents really start as much as possible on the medical, mental health side of things versus the school side, or that if you are seeing that there's an impact in the school setting, go ahead and initiate that process from the medical or mental health side, because then that can be carried over into the school setting and you'll be less likely to have to repeat testing.
Oh, that is a great tip. So why is the testing so important, these evaluations?
Yeah, so in essence, it's a standardization. It makes sure that it makes sure not just clinicians, but everybody involved. So from clinicians to teachers, therapists, and other important and allied disciplines like speech therapy, occupational therapy, physical therapy, it helps to ensure that we are really talking about the same thing. So when the testing process is done and done appropriately and done well, the clinician is really looking at those different areas. So social functioning, communication functioning, adaptive behavior skills, looking at any repetitive, stereotypic, perseverative interests. And so all of that information, and then I should also not forget gross motor, fine motor functioning. It's really quite comprehensive because it needs to be, because of the fact that autism, even though it is a formal diagnosis, and this partially just comes from my theoretical orientation and how I approach the therapy process and the testing process, is that testing is a tool, a means to an end. It's basically a form of communication that somewhat standardizes, but really autism is a grouping of such a wide range of behaviors that test is really crucial at helping anybody who reads that report to know what your child's strengths are, what their weaknesses are, what some goals can be, different specific services that might be recommended. Perhaps medication is not indicated and it's just behavioral therapy. Maybe they don't quite need ABA, and it's more specifically traditional individual psychotherapy. So the testing really helps to formalize, to codify, to simplify and it's an oversimplification, right? Because you don't really, the best way to get to know the child is to get to know the child in real time, but at least it helps all of the adults, everybody providing care and support. It gives a basic foundation for everybody to operate from the first place, so that you are kind of getting like that running start, as opposed to reinventing the wheel each time. And just with autism, because there's such a varied presentation, it's really quite crucial, I think, even compared to some other diagnoses like bipolar disorder, or even anxiety, because oftentimes there's a good bit of overlap. So a child can have those features of ADHD and anxiety, and it's that testing that really helps everybody to be as much on the same page from the start.
Yes, there is such a strong overlap, and a lot of times parents, what they're seeing, they're thinking is one thing, but in reality, it really is autism because of that overlap. And when you're looking things up, it's like, okay, well, the symptoms, as we use in our clinical terms, what they're showing is, it looks like ADHD, but in reality, it's more than ADHD, or it's ADHD and autism.
Right, exactly.
So there is such a strong overlap. So when or what age should parents actually consider testing?
Sure. I think it's critically important that it happens as soon as possible. So from the moment that your child is born, and obviously the first few weeks, your child is adjusting to just world outside of the womb. And typically with first children, it's a little bit more difficult to also know what is typical for development versus what might be more indicative of an autism spectrum disorder. But basically, there are indicators pretty soon after birth. In terms of like the testing community, there are fairly valid tests that parents are asked to fill out pretty early on. So roughly 6 months, 9 months, certainly by 12 months, because there are some screening forms that are very helpful at that age to begin the testing process and identify kids who should be who should undergo further testing. So part of the reason why like collaboration and really starting in the medical realm, so with the pediatrician, is really important, is because oftentimes pediatricians are the first ones to be able to catch that through some of the questionnaires that they provide. And so it means when you are at those appointments, one of the toughest things for parents, and the part that always really tugs at my heart, is when, because I have worked with pretty young infants and early age toddlers, that parents often struggle with accepting that that their child is developing along a trajectory that's different than what they were expecting for their child. And so there can, those initial questionnaires, 6 months, 9 months, 12 months in the pediatrician's office, 18 months as well, are really important to answer, even as painful as it may be, or to answer as honestly as possible, because access to services early is extremely important for kids on the spectrum. And that's why pediatricians are screening early. And so I really recommend as soon as possible. So there's joint attention. So you expect a child to start to orient. If there's a ball in the corner of the room, you expect the child to look at the ball, look back at you, and look to see that and look back at the ball, because they want you to look at the ball with them. And that's called joint attention. And so that's something that you really start to see emerge by about 6 months of age. Mm-hmm. So it really happens a lot earlier than people realize. It's just that once kids become more communicative anyway, around 2 years old, 3 years old, certainly, you really, when you're expecting kids to use like 3-word sentences by the time they're 3 years old, if a child is not doing that, it becomes much more apparent to a wider range of people. But for a professional, like for myself and others who have been trained in diagnosing autism, we actually can see these markers at least a year ahead of time, oftentimes. Obviously, there are certain, again, for what used to be Asperger's syndrome, there's a little bit more subtlety. But again, the social deficits are often there before others tend to realize that it's there.
Yeah, I completely agree with that. I know for myself personally, and those who listen know that I saw the markers in Millie at 6 months,
mm-hmm.
Because one of the things was the joint attention that we weren't seeing,
mm-hmm.
thinking that, she was deaf, things like that, even though, we got her hearing tested and her hearing was just fine, it's like, why is there such a slow reaction time between me saying something or a loud bang and her having a response?
Mm-hmm.
Because, neurotypically, children will have a quick reaction, especially if they hear something loud and it startles them.
Mm-hmm.
So that was definitely one of the markers that alerted me. What should parents be looking for as far as when, I guess, developmental concerns?
Mm-hmm.
Because like you were saying, we're not seeing things, from 0 to about 2 years. Is it that 2 years when they have that burst of developmental milestones that you're like, okay, they're not doing this. Now
mm-hmm.
I'm concerned. But what should they be looking for prior to 2?
Yeah, definitely. So joint attention is the big one. And that's one, again, that you see very early on by 6 months old. Kids really should be able to do that. They should be also pointing at objects that they are requesting. I like to see single word usage by 1 year old. And that means, like, if a child, again, sees a ball, they are pointing to the ball and saying ball. And so they don't have to necessarily walk over to it, pick it up, and show it to you. They're able to point, they're able to label it. We also sometimes what you will tend to see, again, are those particularly strong reactions or highly aversive reactions. Sometimes it's to particular types of clothing. And these things often start early. So sometimes parents will wonder, like, obviously there's no allergy because there's no rash, there are no physical indications, but sometimes a child might start to be more squirmy or upset, highly irritable, and you can't console them. Those are things that tend to be a little bit more difficult to notice as kids move into closer to that kind of like, let's say 15 to 18 months of age range, that's when they're able to kind of vocalize or give better signs that they're having sensory sensitivities. So might pull at clothing, tug at the tags. You also might see at that age is also when you expect to see kids put things in their mouths. So mouthing is definitely appropriate of objects, but if your child is continuing to do that beyond, let's say 2.5 years old, where they're 3 and they're really continuing to do that, that is often, again, so it's not required for diagnosis, but it's often an associated feature. Things like gross and fine motor challenges. So I like to see that kids are walking independently, and some may disagree with me on this, but generally, if a child is taking, if they're reaching that 15 months of age, and they're not successfully walking independently, in addition to some of these other factors, then again, that's just another thing to take into consideration. We want to see kids starting to hold utensils, so like a spoon, fork, and it obviously child appropriate, but that they're able to grasp that by the time they're 1. The pincer grip, we want to see that by about 3 to 4 years of age. Another one that's a little bit controversial is potty training, toilet training. So when I first started in the field and when I was going through graduate school, we used really 3 years of age as being that marker that if a child was not, and really completely potty trained for both urine and for stools, if they were not potty trained by 3 years old, again, that was just another marker. We are living in a time where it's a little bit more relaxed. So for myself, I've moved that line, but really for a lot of standardized autism gold standard assessments, that 3 years is something that is, was the line. So let's see, there are so many different things because it cuts across so many different areas. Language, we want to see single words by 1, 2 words by 2. So throw ball or me hungry, and then 3 simple 3-word sentences by 3 years old are also things that we want to see. We want to see that kids are playing, they're taking interest in other kids, that they are, they might not play collaboratively before about 3 to 4 years of age, but certainly by 3 and 4 that they're playing together with other kids in the same activity. We also want to see in very young kids, again, so kind of going back to that 1, so 12 months, certainly to 2 years old, that they are developing imaginative play. So pretending that a long rectangular block is a cell phone, pretending that a banana is a phone as well, pretending that like a brush is a microphone and they're singing with it. So we look for imaginative play by the time, certainly really they start pretty early on. So we like to see it by 18 months. So typically we like to see that autism is diagnosed by 3 years of age because of how important early intervention is in the trajectory and developmental outcome. And part of the problem is that for brown-skinned children, this often doesn't happen until later. So it really is important for parents to also go with their gut, go with your instincts. And if you feel like there's a developmental trajectory for your child that doesn't feel right for you, to certainly investigate that, but then also to be open to the suggestions of others, and that if others are suggesting that there might be a neurotypical difference or just a difference in your child's development, to go ahead and seek out those answers, because knowledge is power, and then early intervention and early access to service really is important.
Yes, it's so important, early intervention. And as you discussed, in our communities, there's such a gap in actually getting the diagnosis for our children. And when it comes to the actual testing and the rates regarding testing in our community, what are those rates looking like?
Sure. So over the past few years, it's actually been improving, which is wonderful because it means that the word really is getting out, the message is getting received, that access to services, that it is actually increasing. Schools are probably doing a better job. Schools are doing a better job at reaching brown skinned kids earlier, and pediatricians are being more aware. Basically, these biases that have been in play. Presumably we're seeing a reduction. And then also just parents are also asking more questions. So there are a lot of factors for the reduction. So previously we were seeing rates of where white children were getting diagnosed 1.5 times more commonly than African American kids, Latinx kids were getting diagnosed. And so we're seeing that there is still a greater disparity between white and Hispanic families. And there's actually also a gap between Black and Hispanic families. So it's kind of whites are getting diagnosed most frequently, then Blacks, then Hispanics. And we're seeing a decreasing trend over time, which is great, but it's still, we want to see those rates as equal. We don't want a difference between those rates. And so certainly for our Hispanic families, unfortunately, we are seeing, unfortunately, not even across autism, but just even across other areas, that there is more of a gap for Hispanic families compared to Black families. But again, relevant to your viewership and your audience, that, kids who are Black are being diagnosed less frequently. Historically, some reasons include, so discrepancies between income in households. So with white families typically having a higher average household income, it means that they have a higher access. They're more likely to have access to services that are going to be able to catch the diagnosis early, like on the medical side and in school systems. And then there's also there's been a difference historically in how kids are viewed once they do enter into like the school system, that brown and Black skinned kids are more likely to be seen as having behavioral problems, so diagnosed with oppositional defiant disorder or ADHD, conduct disorder, rather than being diagnosed with autism. So those have also been barriers. So it's looking like these factors are starting to change very, very nicely. But again, lots more work to do because there is still that disparity.
Yes. And can you walk us through how an evaluation process goes for the parents? Because I know that, a lot of times parents don't know what to expect. So because of that, that makes them apprehensive and not willing to go through the process because they don't know what to expect. So can you walk us through typically what happens when parents come to your office to begin the process?
Yeah. So at my office, and there can be some variability depending on whether you're going through a medical center, a hospital, a university, or a private practice. But basically for us, what we do is obviously, so we collect as much information as we can ahead of time, and we like to have parents provide that as early as they can. So any records that are relevant from pediatricians, from other service providers, we look for, we have our own intake documents. So, I think ours is about 6-7 page long intake questionnaire, and it goes through a lot of different things. It gets into developmental history. It gets into, toileting history. It gets into family history a little bit. It gets into academic history. We actually have a whole separate form for behavior problems because there are very specific questions that we get into that. So the number one thing is that parents should be prepared to be filling out a good bit of paperwork, but it's worth it. It helps us to really get an understanding for your child, so that by the time you show up for your intake appointment, that we are having to ask less questions. We're more kind of diving deep into the particulars about development and really getting specific examples to help us formulate what this picture is. So you'll have that initial diagnostic intake session, and usually you'll bring your child as well. And I know one of the big things is the parents are often concerned about how freely they can talk about certain things with their child there, or to what extent will their child be a distraction during the session? And, as child clinicians, we're prepared for all of these scenarios. So what's making it things are a lot different right now with the pandemic anyway, and that a lot of testing just can't happen right now, with the difficulties with face-to-face. But typically, let's say like the pandemic was not going on, that, we have toys available for the kids to be playing with. And again, we're just used to it. Like my training was very much that, the child is there and we are navigating the questions as the child might be engaging in behavior problems. And also seeing those behavior problems, again, is just added information. I always say to parents, I'd much rather see it than not see it because, I'm getting to put eyes on it. I'm looking at what are some of the factors that are eliciting these different behaviors from your child, but then also seeing their strengths too, and being able to see, maybe the child will allow for us to be in the room together alone without the parent being there. So parents shouldn't worry too much about having to bring your child to the first session. We're ready for that. There might be some time where you're asked to leave the room. Parents can sometimes feel a little bit nervous about that. Try not to be. Again, it's just to see more about how your child is going to function both in your presence and in your absence. That helps us to understand the scope of things. And then from that point on, I'll be a little bit more vague because I don't want to get into the specifics of what we look at in testing, but it's very broad-based. So we look at, how, as I mentioned earlier, so for an autism diagnosis specifically, we're looking at social functioning, we're looking at joint attention, we're looking at imaginative play, we're looking at communication skills and how effectively a child is able to communicate. We're looking for any restricted or repetitive interests, perseverative interests. There are some other things that we do too. So parents might be asked to fill out some questionnaires. We will ask the child to do certain things and interact with toys in a certain way because, again, we're collecting information and looking to see how they respond in comparison to, the tests and how they were quote unquote normalized. It's just the process of making sure that the test is valid across different kids, different races and things. So so I'll keep it. That's probably as specific as I can get at this point without giving away some of the details, like the intellectual property of the tests themselves.
And usually how many evaluations are done? Is it just one evaluation or is it several that are done? I know the gold standard is the ADOS-2.
Mm-hmm.
Is that the only test that is given or is there multiple evaluations?
There are multiple, and that's definitely, I am very much like a psychology nerd. I've always loved psychology. So seeing how things change over time and seeing differences across clinics. So when I was coming up in my training, the ADOS wasn't quite as big. It was gaining steam. The ADIR was actually the popular one, and it's a questionnaire. It's a questionnaire just with the parents. The CARS was very popular as well, and so all of these things continue to be very popular. And so when it comes to the ADOS, so probably in the last, certainly 5, maybe even 10-ish years, the ADOS has been considered the gold standard. And that, again, I hate to put it on insurance companies, but insurance companies have identified the ADOS as being the gold standard, and it must be required for a diagnosis of autism. And so the ADOS it's a test that's given, but you're interacting with the child and you're observing them. That's what the O in ADOS stands for. Mm-hmm. And so I think that's it's very much to a disservice for just really one access to services, because you have to get trained very specifically in the ADOS, and it's a significant amount of training that has to happen. And so it's often difficult to find people who have that training. So it's that in and of itself is a barrier to services, and you really can diagnose autism in different ways without specifically using the ADOS. So through the ADIR, through there would also be like cognitive assessments that are done. There's really there's the view of the ADOS as being the gold standard. It is true. It is a very good instrument, but is by no means actually the only way to get a valid diagnosis of autism spectrum disorder. So one of the things that parents have to just be mindful of is really contacting your insurance company to find out, one, do they require an ADOS diagnosis, especially, and I would say whether or not they require an ADOS diagnosis to approve ABA services. You might not know whether you need ABA services until you get through the whole process. And so that's why just asking the question up front is important, because then you want to make sure that you are finding a practitioner who is trained in administering the ADOS. Because then if you go with a practitioner, a doctoral level practitioner who is not trained in the ADOS is not given, your insurance company required it for autism testing, and that means you have to go back again for additional testing with a different provider. The good thing is that the ADOS is actually, it can be administered, it can be administered in a morning, a little over an hour or two. And so it's not, it goes pretty quickly, but again, finding a provider can be difficult. So so that really is the overall bottom line on the ADOS, but the ADIR is quite valid. Best case scenario is that both are given, and then a few additional measures as well.
And I know parents ask me this a lot. Once their child has the evaluation and is given the diagnosis, do they have to be evaluated and tested every so often, or is it one and done test?
Right. Yes. Very good question. So it is, again, so much is dictated by insurance companies. So lots of times for families who are fortunate and able to pay out of pocket, a lot of this is not as much of a concern. So even if your child didn't quite meet criteria for a diagnosis of autism, but you have the means to afford ABA services, you can pay for ABA services privately. It's the insurance companies. It's compliance with their regulations. So for some, you might just get that diagnosis once, go through the testing once, and then not need it again. Sometimes you will. So then, when you need an IEP, that might be more likely to see a refresher. Lots of times, some of the testing that's repeated will be to see to the extent to which that autism that you're seeing that presentation. So, and again, that would be a certain particularly beneficial markers, like in 5th grade, getting ready to go to middle school, and then probably again in 8th grade before you go to high school. But if you don't test in 5th grade in anticipation of middle school, that's fine. I would say testing before high school becomes important. And then potentially testing again before heading off to college, because they're just developmentally, there's so much difference between those time periods that it's important. And not to say that, the whole concept of whether or not a child can be cured of autism is a whole other discussion. But lots of times through treatment, a child can have and that's the goal of the early intervention, is that they will catch up in terms of their developmental trajectory, or that they will over time have more of a neurotypical trajectory. So the need for testing it depends on the situation. It can depend on, again, the insurance companies. Sometimes they require repeated testing after a certain amount of time to continue to approve ABA. And then I generally recommend that it happen before high school and then before college. Lots of times colleges will require it anyway as parts of accommodations. But if you feel like your child is, really functioning well enough, and you feel like they have a very more subtle presentation of autism, then the testing really might not be required. It might be needed just that once initially, and possibly not again after.
Thank you for clearing that up, because I know for me that one always stumbles me up, because we never went through our insurance because it never covered anything. So we were fortunate enough and are fortunate enough to be able to pay out of pocket for everything for our child. So that one I'm like, I don't know. So I'm going to ask the expert. So thank you.
My pleasure. Yeah, like so much of this, the answer is check with your insurance company because it is like, that's really what's going to dictate everything. So yeah.
And what do you have as suggestions or advice for parents who are thinking about getting their child evaluated or who are currently going through the process of getting their child evaluated?
Yeah, and it is a long process. So I would say to most importantly approach it with an open mind. But I always expect that parents will approach it with like that fierce protective spirit of their child. And so ask as many questions as you need to. We're used to it. We're prepared for it. We want you to be able to have clarity about it. So ask as many questions as you need to. We are really here to help you through this process. This open-mindedness does go both ways, though. So sometimes for parents, it's not just for parents who really don't believe that their child has it. Sometimes it's the case that a parent feels, or a caregiver feels very deeply that their child meets criteria for ASD, when really it's explained better by different diagnoses. And so it's really being open on both sides of this process. And it also doesn't mean that your child won't get access to services. It just won't look like necessarily the specific picture that you had in mind. And that can be the case even with an autism diagnosis. So certainly ask plenty of questions. I am a very strong advocate for, trying to get the services that are really needed. And, a lot of practitioners are willing to try to work with you. They'll provide recommendations in the report in terms of whether speech is necessary or whether occupational therapy is necessary or physical therapy. One of the things of my practice is, although we don't have like speech, OT, and PT quite yet, but the goal is to, over the next few years, start to build that in and help parents coordinate schedules. So looking for help for coordinating schedules is another thing to absolutely ask, and ask for those recommendations to be put in the report if they weren't. Definitely read over the report. Yeah. Ask that I like for, I have my clinicians and I make sure I have the report ready at the feedback session, because that way you can actively ask questions as you're going through it, rather than kind of getting the feedback. The report is sent to you later, and then you have more questions. So I would say, just ask that the report be ready for you at the feedback session. And then, of course, if you have additional questions later, absolutely reach out for clarification if you need it. Trying to think what would be some of the other. I would say those are the main things that I encourage families to do when they're going through the process, and just seek also support wherever you can, from family, from the teachers. I guess as it relates to school, sometimes depending on like the culture at the school or the mindset, it can be somewhat contentious. So making sure that you have the support system that you need from family, friends, other allied professionals becomes really important. Taking care of yourself in this process is also really, really critical, because if you're wearing yourself out in the process of getting services for your child, who's gonna be advocating for your child? So you do have to make sure that you are taking care of yourself first. And that's where checking in with your friends, with your loved ones, with your support system really, really becomes important. There are advocacy groups that you can join, mom groups. There's so much. So take advantage of the resources that are out there, and, don't hesitate to suggest new resources. So there are, the Autism Speaks and autism societies exist all around the country. So tapping into those. And if you're seeing a lack of services, especially in your area for Black and brown skinned kids, not that you should be taking on even more, but the squeaky wheel does get the grease. So bringing those factors to the attention. Maybe it's getting your own support system in the process of testing, just like you did. So it's a community is really important. I know that's why your podcast is so successful, and why everybody gravitates towards it so much, is because you do talk about those topics that are difficult, and you're providing guidance and awareness for families. And so, I think that while the idea of jumping into yet another project might be difficult. It could be just the thing that gives you the energy and invigorates you to be able to continue to provide the help and advocate for the support that your child needs.
Oh, thank you so much. And thank you for all of that great advice. So where can the listeners find you and connect with you?
Sure. So I'm all over social media. My practice website is brighterhopewellness.com. My practice is on Twitter, Facebook, Instagram, Brighter Hope WC. My personal handle, my professional handle, I should say, is Cindy T. Graham, PhD at, on, again, all of those platforms. I really love to engage with people. So I do encourage people to reach out. Our practice website has contact information that's readily available, again, as do all those platforms.
Yes, and I definitely recommend, if you are in the Maryland area, to check out her wellness center because it is amazing.
Oh, thank you.
Thank you for being on the podcast. Thank you for providing such great information. I'm glad you could be on the show. And thank you, everybody, for listening. And we will catch you on the next episode. If you haven't done so, make sure to subscribe to our podcast so you can always be notified when a new episode drops. To get the resources shared on today's podcast and the show notes, make sure to go to autisminblack.org/podcast. And be sure to share your takeaways from the show on IG stories and Twitter using our official hashtag AIBpod so that we can find them and share them. And if you want to continue the conversation from today's episode, make sure to join our Autism in Black podcast Facebook community. And please make sure to answer the questions to gain entry. Thank you for listening and joining me this week. Have a good one.